Well, welcome back. Thank you for joining us. We're starting with part 4 of our 7-part series on revenue cycle. Today's series will be discussing the challenges with Charge Capture 101. So let's talk on a broad level what the challenges are with charge capture in our revenue cycle today. I'm not talking about the coding or things of that nature. We're talking more about communication, education, the actual charge descriptions, assigning of charges, and even the data master maintenance process. Resources. That's usually a concern in most hospitals. The departmental oversight, or is there departmental oversight? Standardization. Are we doing this at a corporate level, a facility level? Who's in charge? Who makes the decisions from a revenue cycle and charge capture perspective? What technology are you using? Are you even using technology? We'll talk a little bit about that. And then lastly, our favorite part of revenue cycle and just charge capture in general is the regulatory and compliance updates. So starting with the communication, do you have the right people involved? Do the right people know that they should be involved? That's the first aspect that you need to look at, and you need to improve the communication to them. The educational component, have you been consistent with the staff that needs to be trained? Do they know that they needed training? Are they aware of what the training is? Have you made time for them to be trained, whether it's, a hospital type of seminar or whether you're giving them a webinar to review? That's important. They need to have the time to get the information that you need them to use for your charge capture process. Charge descriptions, do they make sense to the people who are choosing them? They make sense from a charge description master perspective when revenue integrity is setting them up. But does a nurse who's picking that service understand it? I know personally, most people refer to the blue underpads in supply chain as chucks. Well, if you talk to a CDM person, they have no idea what a chuck is. So you need to be consistent in your terminology and your own jargon so that people can choose the right service at the right time. Assigning charges. Are they accurate? Are they complete? We talked about this in our prior presentations. We're going to talk about this again. Going back to that hip example, it's just not good enough to put the implant on the page. You have to make sure you got the insertion of the implant. If there's any other linked charges, when the charges occurred, where they occurred from a departmental standpoint, that's important as well to get that revenue code accurate. Data masters. Again, are they up to date? Have you spent the time to synchronize? Is someone going to go into your charge description master and know what they're looking at? Or are they going to look at dated information? Is the pricing going to be accurate? These are all important challenges when it comes down to picking the right procedure and making sure you're charging for the right item or service that you provided to your patient. So where does that all start? It starts with your resources. And most hospitals, as I discussed earlier, have some limitations, especially some of your smaller organizations. So have you reached out to the right people? Are those people wearing dual hats? If they are, then you have to make sure that you've given them some, extra special care and the appropriate training. If they're doing too many jobs or just have too many jobs to do, they have to know what part of the charge capture process they're responsible for. And the right people need to be consulted. So the clinicians do a lot of the charging. You need to consult them when you're making some of these decisions on how do we, term a description or how do we label a supply that we're putting in our charge master. And then we need to input that oversight perspective. So who's the one who's in charge of reviewing from a departmental arrangement of, is everyone doing their job? Is everyone doing their job correctly? Where's the ownership of charges? Is it at the nurse manager level, or is it at the nurse level, or is it at the administrative level supporting that department? This all should be documented and everyone should be aware of it so that all the pieces and parts can come together. Now let's talk a little bit about the standardization when it comes to charge capture. How are we doing this in your facility? Are you an IDN? Do you have multiple facilities? Have you acquired facilities? That's happening a lot in today's industry. So are we setting up our charge master from a facility level or a corporate level? If we're setting it up at a facility level, how do you make it make sense throughout the organization so that when you want to look at things from a global perspective, all of your hospitals within your network? Do you have everything labeled appropriately so there's an equal comparison or an easy comparison to do? Physician preference items, that's another area that we usually talk about when we're talking about standardization. If you're supporting, multiple hospitals that have orthopedic services or cardiac services or GI services, have you talked about what product in your value analysis discussions you're going to offer? Has that been communicated? Again, going back to the challenges, let's make sure we're communicating with the people what our policy is, what our process is, and how we're implementing that. And the regulatory and compliance component. I can't stress this enough. You're probably tired of me saying this throughout the presentations, but whose responsibility is it? No one wants to get that little piece of paper or that warning that someone's coming in to review or audit them. This is where that concern can be stopped. So if you've documented who's going to be responsible, if you've put out the updates from a compliance and regulatory standpoint, if you've educated your staff, and if you're monitoring that these simple steps are being, adhered to, then you should be good. You won't have any concerns when you hear you're getting an audit. And lastly, let's talk about the technology. Are you utilizing the technology efficiently? We talked about that previously, but it's not so much is it just efficient, but is it aligned with your goals. If your technology isn't supporting the goals for charge capture, then it may not be doing you as much good as you hope. So if you have a program out there that you've invested in, if you have a software out there, or even just a methodology or practice, have you aligned it with your goals for charge capture specifically? If you have, then you're on the right path to overcoming that challenge. All right, I want to thank you again for joining us today, and I hope you stay tuned for the next part in our series, which will be Challenges with Charge Capture 201.